A major problem area for many of us that can also contribute to our back pain is our hip mobility. So hip mobility, when we think about it, we're going to look at 4 different components to address if we have good hip mobility or not. First one is going to be our rotation type movements. So we have internal rotation, or when our knee is inside of our foot. We have external rotation, so when our foot is coming inside of our knee. Then we have our extension and flexion. So extension, when our thigh is going to go behind our back, and then flexion, when our thigh is going to get closer to our chest. When we're talking about problems and how it can contribute to our back pain, flexion is rarely the problem, okay? Usually flexion in our hip is pretty solid. Most of us have decent flexion, if not too much flexion within our hip. So we're going to look at movements that can kind of address the other 3 problem areas, which are that internal rotation, external rotation, and hip extension. So try these movements. The first one is going to be a 90-90 rocker. So we're going to kind of sit in this 90-90 position. So one leg is forward, one leg is backwards. We're going to gently rock our chest forward to the front leg, hold it for like a 1-2, and then rock backwards to our back leg, hold it for a 1-2. We're going to repeat this for about 5 reps, and then we're going to change sides and do it again. The other movement that we can add into our tool belt in order for addressing our hip mobility, super simple, is called 90-90 pass-throughs. So 90-90 pass-throughs, we're going to once again be in that 90-90 position, but this time we're going to switch from which leg is forward while trying to keep our heels and butt on the ground. So we're facing this way. We're going to slowly pass through the middle, keeping our heels on the ground the entire time until our legs have switched positions. Then we're going to go back and forth roughly 5 times. So test these out. Let me know how they go. See if they help your hips.